Great. Good morning. Today is Tuesday, February 23rd. It's 10:07 a.m. and this is a meeting of the Senate Natural Resources and Energy Committee. We are continuing our work on weatherization, picking up again this morning with a second visit from Mr. Dickerson to help us keep track of the money because there are quite a few initiatives and there's a quote unquote fast track bill as well as the big budget. So we want to keep our eye on the ball while things are moving. And thanks, Mr. Dickerson. You set up to screen share. I know that you've revised your earlier document to make it more comprehensive.
I think so. Let me give it a try here. Are you seeing my screen?
Yes, sir.
Okay. So there are, I think, two main areas that I wanted to cover today based on some of your feedback from the last meeting. And the first is, I think you wanted a more comprehensive set of numbers that wasn't limited to just weatherization, but was more encompassed energy savings as well. And so you'll see my chart here, and then I've got lines for the home weatherization assistance, which was there before, the BGS, state energy management, which was there, and then the VHFA program at 16 million. What's new is I've now added the community clean energy program at 10 million, several expenditures from the T fund for electric vehicles and electric vehicle support, and then this money to VHCB, this one-time money. So I guess to go to the solar spending piece, I added some details off to the right side so you can see this as well, but money would basically be transferred from the general fund to the Clean Energy Development Fund to sort of seed this new program. The funds, while I say the year is FY22, I think the funds would be spent over several years as the program got up and running, and then they began providing the incentives. The T fund piece totals 5 million. There's 2 million that's just directed incentives for people to buy new vehicles. This is something that's been ongoing, although I think it requires new funding each year. So you'll see I noted that in FY20, there was 1.1 million put towards it, and then in 21, there was 950,000. And then the next, this line 5B, is just education and outreach. It's a partnership with a program called Drive Electric Vermont that just supports EV expansion. That's 250,000. And then another 250,000 is for a new program that would incentivize. Actually, it would provide some education for dealers and sales force on electric vehicles, and then it would also incentivize the sales force to get those vehicles out the door with I think a max incentive of up to 400. But there was some language in the governor's transportation proposal that I think, would expand on this explanation, but I tried to keep it simple.
Sure.
And then this is another new program, Replace Your Ride. This is line 5D, 1.5 million. This would provide incentives for people to get rid of older, low efficiency vehicles and buy electric vehicles or buy bikes, electric motorcycles, or switch to public transit. And the incentive would be up to 3,000 with some restrictions, I think, on income. And then finally, 5E, this is $1 million to provide funding for people to, I see. This would provide funding for people to build chargers for electric vehicles on multifamily housing. It's $1 million for that. Now going down to VHCB, this is where Senator Bray, I know you wanted me to include this, but as I read over where the money would go, it seemed less. Obviously it's for a good purpose and that it would expand affordable housing, but I didn't see the direct linkage between energy savings. I'm sure there's indirect benefits because obviously if you build new housing, it's more it's going to be cleaner and use less energy. But the language in the governor's budget for this 20 million in general fund and then 4 million in capital fund is really just at least with the 20 million general fund, it's just building affordable housing. I know VHCB, I looked at some documents that I believe they provided to another committee. They wanted a little bit more flexibility to use some of the funding for conservation projects, but I didn't see anything specifically saying, for energy specific expenditures, such and such amount. So I noted it here, but it didn't, I just said proposed allocations do not appear to have primary aim of achieving energy savings. And it's the same with the 4 million, although the 4 million is for a broader array of uses. You see the governor's capital proposal has 1.8 million for housing and conservation, 0.9 million for ag water quality, and then 1.3 million for land conservation and water quality projects. And then once again, just said these don't appear to have the primary aim of energy. So if you include the VHCB money, it's 55 million of general fund. If you don't, it's 35 million. And then there's 5 million of T fund and 4 million of capital bill money. So that's the money as it relates to one-time energy saving and weatherization. And then just to jump back to VHCB, there's, I know you noted to me, Mr. Chair, that it was 34.8 million total for VHCB. The other 10.8 is just their ongoing annual share of the property transfer tax proceeds that flow back to VHCB from the Housing and Conservation Trust Fund. So the 24 million is one time, and then the 10.8 is ongoing.
Great. That's helpful to see it all in one place. Thank you.
You're welcome. So the second piece I wanted to jump to, I know there were some questions on the state energy management program, so I added a little bit to my previous slideshow just to hopefully provide some clarity. So just going back, and actually let me go back to the previous slide. There's a state energy management program that's run by BGS. I think it's somewhat of a partnership with Efficiency Vermont, but it's basically under the current law, it's for doing energy retrofits for state buildings and facilities. And the work is done through two revolving funds, the State Resource Management Revolving Fund and the State Energy Revolving Fund. At the time of our last meeting, I wasn't able to clarify for you the difference between the two funds. So I have a slightly better answer this time. With the Resource Management Revolving Fund, it's typically smaller projects with a value of less than 250. That's their rough split. These projects can be approved by the BGS commissioner only. So in their eyes, it's a little more, it's more flexible funding than the State Energy Revolving Fund. And then as far as the loans, there are no loan term limits as long as the project overall provides a positive return. And I think the return is the energy savings. And this fund is strictly a pot of money that, they can dip into, and then they bring the money back in loan proceeds. And then the Energy Revolving Fund is a bigger pot of money, but it's not so much an appropriation as it is a credit facility. So going down here, it's 8 million total credit facility at the treasurer's discretion. So here, these are larger projects. As I previously noted, there weren't any in FY20, but in FY19, I think there were 4 projects that were valued at a little over $1 million. So these are bigger in general. And then the projects are chosen by the treasurer, BGS commissioner, and then the finance and management commissioner. And these are strict 7-year loan limits. Although BGS did note to me that in addition to the credit facility, the legislature had previously provided about $500,000 in supplemental funds that project applicants can use to help buy down the loan term to the 7-year period. And then just to expand a little bit on the pilot they're talking about, with this $5 million in general fund that the governor's proposed, this would create a new special revolving fund. So it would be different from the 2 existing funds, and it would be only for use by municipalities. I got a list of the types of projects from BGS, so building envelope, lighting upgrade, HVAC upgrades, and then this is the one I'm less clear on, but automation system retro commissioning. I don't know what that means, but I could certainly look into that if you have a question. And then as far as the money going out the door, BGS said really they're going to spend 22 sort of building the framework for the program. And in all likelihood, the first drawdown of that 5 million pot of money would not occur until probably FY23, although it could happen towards the end of fiscal year. So if you're looking at getting money out the door quickly, this wouldn't be that, but it does provide some additional, help for municipalities that I'm sure cash strapped and have a hard time funding energy retrofit projects. And I did note that even once they start drawing down money, it's not all going to go out the door at once, because I noted here that the state energy resource fund only spends about $1 million annually. So this would be something that would happen over many years.
All right, great. Can we go back up a slide or 2? I was just looking at on the fund balance here. So 2.4 or 2.3 in this one. So that's money out the door so far.
Yeah, over the life of the revolving fund. So it's in total.
And so because sort of in a way their line of credit, whatever, is $8 million, they still have 5.2 available for additional grants.
Yes.
Additional loans, whatever, to fund projects.
Yes.
Do you have any idea? We don't need you to go dig it out, but do they provide any data on how much money is actually coming back to them on loan repayment? I don't know if this fund is recharging relatively quickly or it's sort of a trickle recharge. The point is to have the money out the door and the loan term is a long term or something.
I don't think so. I got this information mostly out of there's an annual report that BGS puts out each year that lumps these 2 revolving funds in. I don't know that there was a tremendous amount of detail for the money coming back, but I will say, because at least with this fund, with the credit facility and the 7-year loan limit, they're going to recharge. Each project has to close out in that 7-year period as far as the loan being repaid. So for each project, they would get that money back over the 7-year period. But if you would like additional detail on the cash flow, I can certainly check with BGS and see if I can get some of that.
No, that for me personally, that's fine. I don't know if other committee members have questions, especially given that they have 5.2 or 5.3 available to them if they want to go ahead. So recharging it isn't what's limiting the use. And maybe that's what the last item there, but buying down loan terms is more about encouraging people to take on more projects. Okay. Well, thanks very much. It's helpful to have the extra information, one sheet with all the money on it. Any committee questions for Mr. Dickerson? I guess I have one, given that one of the questions circulating to every committee of jurisdiction is, do you see a need for being part of sort of this fast track budgeting proposal? And my impression is from the walkthrough we just did and other testimony we've taken, it's not clear to me that there's anything in that sort of hurry up category. I know we didn't ask you to analyze that and look into it, but do you have any thoughts on that since you have looked at all the money a little on behalf of the committee?
I mean, if in this fast track bill, if you're thinking strictly COVID recovery, I don't know, but if it's more generally, let's get people back to work by getting money out the door and allowing some of these projects to happen. I mean, I'm sure because the home weatherization assistance program is already up and running, that 4 million could, or I guess the half of the 4 million can be, put to good use pretty quickly. But, a lot of the rest of this is, it's going to take time for them to set up these programs. And, I guess you could make an argument that the sooner they could start setting up the programs, the sooner they could start putting that money to good use. But I think some of this also, with the affordable community energy, I don't know that the administration had proposed language. So, the language is still going to be a work in progress. Same with the VHFA. For those two, I'd have a hard time saying, yeah, you can get this into a bill in a couple of weeks and get it out the door, just because I didn't see any language. But the administration might have different thoughts, and I don't want to risk stepping on their toes too much on this.
Sure. Okay.
So that's probably not the answer that you wanted to hear. But I think given that the home weatherization is up and running, it's an ongoing program. That's probably the most obvious. But like I said, the administration might have different thoughts.
Yep. Yeah. Thank you. And one area that we've talked a little bit about is the workforce development piece. If we're going to pick up the pace on home weatherization, we're going to need the personnel to deliver the services in the field. And that seems like a sooner rather than later in helping build a larger workforce is another place I think we might go. But thank you, Mr. Dickerson. Senator Westman.
So Dan, I have two questions. One, the first chunk, the VHSA, 12 million. They're going to bond for this money. And do you know anything about the payback time? Because now we're down to 16 to 18 million that this is going to leverage. Is that what it's going to leverage, or because we originally heard the original pot of money was 30, that it would the 12 would leverage. So what do you know about that?
I haven't seen the 30 at all. I pulled these numbers directly from the presentation that I can't remember the executive director's name, but I think she had presented to you just before me last week. And so, my impression was that the 12 would get you 16 to 18. I haven't seen the 30 million, and I can't recall.
So that means if we give them 12 million in cash, they're going to they're only going to have 16 to 18 to hand out.
I believe that's the case, and I think, don't quote me directly on this, but I think it's just because that these, as opposed to funding they would receive and then bond for mortgages, which are longer term, these are going to be shorter term lending periods, and so it limits their ability to leverage that to get more money. But like I said, don't quote me directly on that, but I think that's the case.
Yeah, I just don't understand how all that is going to work. I thought when they started, they said it was more, and then we heard last week. The second question, the 2 million for existing on your sheet, the first piece, ongoing incentive programs. Which program was that?
This is the program that provides vehicle buyers a direct incentive to buy electric vehicles. I don't know how much they receive or what the limit is. I can get that information for you. I'm sure.
Is that through Efficiency Vermont? Is that through the Community Action Agency? Who is that through?
I don't know the answer. I can get that.
I'm just wondering exactly who it was, because we've heard about the program that the community actions agencies are running, at least to, is that I think it's mileage share, but I'm just trying to figure out what we're talking about directly.
I think because it's EVs, it's, you know what, I won't guess. I will get the answer for you and get that back to you.
It may be the state's cash incentive that gets applied at the time of purchase. I don't know who administers that, but I'm thinking that's the program it's pointing at, but good question.
Yeah, that should be a pretty easy answer. I'll get it to you.
Yeah, that should be an easy answer, but the question is, if I wanted to add to that, where would I put the money?
Okay.
Okay. Thank you, Mr. Dickerson. Any other questions, committee questions or comments? Anything that you would like more help from joint fiscal in terms of getting our arms around all the numbers related to spending? Okay, I'm guessing we'll have some more. Thanks for continuing to help us, and we'll talk with you again.
Great, you're very welcome. Have a good one.
Great.
Thanks, Dan.
All right. With that, we've been talking about a broad program, and one of the things I wanted to, it's easy for us to sometimes get stuck in the Vermont bubble. There's a lot of good work going on here, but we've been trying to make a point each week of pausing and hearing from people doing work outside the state. And so with that, I wanted to take advantage of work that's going on through the Sierra Club. So let me turn to Mr. Kidd and his colleague, Mr. Kreswick.
So for the record, I'm Rob Kidd, the Sierra Club Vermont Conservation Program Manager. I am only going to be here for if any questions come related to the Vermont work of the Sierra Club. Mark Kreswick is going to take the lead on this presentation. So thank you for the time.
Okay, great.
Absolutely. I want to make sure, can everybody see the screen here?
Yes, please. Floor is yours.
Thank you very much for the opportunity, and thank you for the work that this committee is doing. It's very exciting, cutting edge, and leading around the country. But I'm going to share a little bit about some lessons learned from similar efforts in other states. I'll start with some ingredients for success. This is actually a picture of me cooking with my children here on our induction stove. The most important thing we want to think about here is very much health and safety, particularly when we're spending increasing time at home. As we look forward to ensuring that the air inside our homes is healthy and clean as we spend more time there, that the appliances we're using are safe, that the homes that we're in are healthy and safe. And I know Catherine Klinger from the Green and Healthy Homes Initiative is here as well to speak to some of these things, but also that we can afford to keep our utilities on, that we can afford to keep the lights on, and to be able to move around our communities with good, clean transportation. What we found in the region in which I work, the Mid-Atlantic and the Northeast, including New England, we have the highest energy burdens for low-income families in the United States of America. Low-income families under 200% of the federal poverty limit are spending up to around 10% of their income every year on energy. That's simply unsustainable, particularly at this time, and that's why we have such a huge amount of arrearage throughout for utilities for customers throughout the region. Green and Healthy Homes Initiative did a national survey and also found that if we want to get into doing efficiency and electrification and weatherization in homes, 12% of the low-income families and low-income housing aren't even eligible to receive those programs, to take advantage of those programs we're talking about.
Mr. Chair, may I ask a quick question?
Yeah,
Sorry.
Senator Campion.
And I do apologize for interrupting, but did you say that low-income Vermonters have the lowest share nationwide or the highest share of energy costs nationwide?
The highest burden in the region.
Highest burden. I thought you may have said the lowest burden, but I could be wrong. So I just want to make sure. So it's right, the highest burden. Thank you.
Yeah, absolutely.
Of
Just
their
make sure.
income.
Oh, go ahead.
Senator McDonald?
Of the highest, what percent of their income spent on energy?
Correct. Yep, that's exactly right. And I know, again, Catherine can speak to this better, but in some communities, the percentage of homes that can't take advantage of these efficiency and weatherization programs can be as high as 40%. In Baltimore, for instance, 43% of low-income families and housing can't actually access these programs, again, because of health and safety needs in the community. From a climate perspective,
sorry, I've heard that twice now. I feel like I need to pause and make sure I really understand what you're saying. They can't access the program because of health and safety needs. In other words, their housing is so unhealthy and unsafe that it doesn't merit. You need to check that box before you go on to worry about energy costs for that home. Is that
exactly?
What we're talking? Okay.
Exactly. Yep. From a climate perspective, and the Brattle Group recently did a study looking at New England in terms of the electric demand that was necessary to ensure that the states in New England could achieve their climate pollution targets, including 80% reduction economy-wide in New England specifically, and found that efficiency, electrification were absolutely critical to meeting those goals, and that as we look forward to ensuring that we're reducing climate pollution the way we need to, it's absolutely critical to link these things together. If we are investing in efficiency and weatherization without electrifying, we could actually be exacerbating indoor air pollution problems from gas appliances. Here in DC, where I'm from, one of our local unions, LIUNA, the laborers union, and a group called Washington Interfaith Network, we're doing a weatherization program as part of the ERA funding, federal funding, more than 10 years ago, and found there were homes they couldn't even get into to weatherize, again, because the pollution from gas appliances was so bad. The indoor air quality wouldn't allow them to weatherize. So it's really important that we link these things together, that we are investing in health and safety repairs, efficiency, electrification, all in one package. As we move into those homes, it's more efficient. When we go into a home to do health and safety repairs or efficiency, it's more efficient and cost effective to also upgrade the wiring to be ready for whether it's electric vehicles, solar on roofs, induction stoves, heat pumps, all of those technologies, that the wiring is upgraded, that we're ready to electrify the buildings at the same time. This is the most cost effective approach for achieving our climate goals, as well as reducing energy burdens. I'm going to talk a little bit later. California Public Utilities Commission just completed a study this month looking at these same questions of energy burden and climate goals, and found that an electrified everything approach that included heating, cooking, vehicles, transportation, all of that in one package would save customers up to $100 a month. $100 a month in savings compared to continuing to rely on some of their existing gas appliances in particular. So within the region, the Mid-Atlantic, New England, it's important to recognize Vermont is not alone. Just last week, the Massachusetts legislature introduced their own comprehensive weatherization, efficiency, electrification approach, targeting more than 1 million homes over the next decade. That's 40% of the housing in Massachusetts, with a particular focus on environmental justice, low-income communities. And I'll talk a little bit again in a moment about the legislation that Massachusetts set up. But similarly, throughout the region, every state that's taken a look at this has found the most cost-effective approach, the most equitable approach is these comprehensive whole home retrofits that cover every aspect of a home's, from health and safety repairs, again, efficiency, weatherization, electrification, all in one packages, starting with affordable housing and low-income families. One of the reasons for starting there, and just to underscore this, Massachusetts found, the Massachusetts administration found that as customers start to switch off the gas system, and if gas utilities try to rely on things like fossil gas alternatives like hydrogen or renewable natural gas, the remaining customers on the gas system, rates would be going up 2 to 3 times over the course of the next few decades. That's simply an unsustainable increase in gas delivery costs for customers who are already struggling to afford energy or housing in our communities right now. So the key components of this, is you have heard from others and are developing, is an interagency task force, bringing together the various agencies that have a hand in housing, weatherization, energy, health, along with key stakeholders from the affordable housing community, low-income advocates, to ensure that we are putting together this comprehensive program. Again, that interagency task force is absolutely vital in order to braid together these different potential funding streams, as you've been hearing about from others. That includes housing dollars, weatherization dollars, health dollars, transportation dollars, bringing those funding streams together into one easy to access, one-stop shop for customers and families and businesses to be able to take advantage, not have to go through and navigate the complexities of half a dozen different programs in order to be able to achieve this comprehensive investment in homes and buildings. To ensure that all customers are taking advantage of energy assistance programs that are available. One of the great opportunities, Virginia just instituted a percentage of income payment plan that limits the energy burden for low-income customers. It says, you can't pay more than 6% of your income on energy, on electricity, rather than if you are in particular, again, a low-income family struggling to afford energy, just straight up limiting that energy burden. It's a great opportunity to make sure that as we go forward, we don't see those incredibly high numbers that I shared earlier. Again, completing all the health and safety repairs, weatherization, efficiency. Oh, sorry, Senator, do you have a?
Yeah, just a quick question. So on that percentage of income payments plan in Virginia, who does the utility get, quote unquote, made whole? Does the state fill in any the cost above 6%? How does that? Can you just say a little bit about how it works?
Yeah, absolutely. So it's still being implemented. It was passed last year under the Virginia Clean Economy Act, and there's legislation that's actually in the final week of session there to further implement it. But the core of it is there is a charge on all ratepayers that is used to make whole the utility for the difference between what customers would be paying and what they will be paying based on that income limit. One of the unique things about Virginia, as well, as they link that explicitly to customer participation in energy efficiency weatherization programs, so that we're not wasting energy, right? There's no incentive for a customer who suddenly isn't paying for a certain amount of energy because of these income limits to just kind of waste energy. So they have to participate in efficiency and weatherization programs in order to be eligible for the income limits.
Okay, thank you.
Yep. Again, so completing all of the different aspects, health and safety repairs, weatherization, efficiency, electrification, grid interconnectivity, ensuring that we can actually manage the increase in electric demand from both vehicles and heat pumps, induction stoves, and resilience, ensuring that we have a reliable, resilient system so we don't experience the kind of situation that we saw in Texas the last few weeks. I've got family there in Texas who was out of power. We've got to make sure the lights stay on. That's absolutely fundamentally critical. That was largely caused by the gas system again, that the gas system wasn't prepared for those kind of events. We got to make sure that our buildings, that our electric system is ready so the lights are able to stay on. And then finally, including protections from displacement and gentrification. If we're going into a home, particularly affordable housing, low-income families, they've got to know they can get back into that home, and that they're not increasing rents. So even if your energy bill, is able to be held constant and reduced, we need to make sure that rents aren't going up as a result of the investments that are being made in these buildings, in these homes. Some of the interesting lessons learned in conversation in Virginia in particular, I wanted to share. The reason for that interagency task force is to learn in this process. One of the things one of the state agencies raised through the discussions about this program was, well, what if it's actually cheaper just to build new homes for some of these customers instead of this comprehensive retrofit approach? So rather than mandating the comprehensive retrofit approach, we work together on some language to make it a little more open-ended, because it may be that for some of these homes, it's actually cheaper to build new housing rather than to make these retrofits. So kind of working through that process with the different agencies to understand the different approaches and concerns that they have is really critical. And I wanted to underscore that interagency task force piece. Finally, again, I mentioned, the incredible cost savings that come from this approach, getting into buildings on investment cycles so that whenever a home is making an upgrade for whatever reason, that we're achieving this comprehensive approach that includes electrification, efficiency, weatherization, will save customers money, massive amounts. Again, in California, the Public Utility Commission found it would save up to $100 a month. I mean, it's a remarkable amount of savings of this approach compared to continuing to rely on fossil fuels. And the jobs that are created. Again, we did a study with Bethany Jones, a researcher in the University of California system, who found more than 100,000 jobs could be created. We also want to make sure those jobs are quality jobs. One of the components of the Massachusetts bill was that any time public funding was being used, a project labor agreement was required. So there's also a lot of opportunity for workforce development, for ensuring that the work done here is quality. Apprenticeships are a key part of this approach as well. So there's a lot of ways to ensure that the jobs being created are quality and that customers are saving money, as well as improving health and safety and reducing climate pollution in this process. But this does require, kind of a fundamental new approach to how we think about buildings, appliances, costs, our energy efficiency programs. Instead of continuing to subsidize gas appliances, for instance, even more efficient ones, to redesign our energy efficiency programs to focus primarily on electric appliances and energy efficient cold climate heat pumps, for instance, but also the cost effectiveness frameworks we use to judge these different programs, ensuring that the health dollars and the health savings and benefits of these programs are being included. So this really does require, as you have done so far, and just want to laud your leadership for taking that step back and rethinking kind of how are we doing all of this? How are we bringing these different programs together into one comprehensive package? It's exactly the right approach. Other states are starting to figure it out, but you're on the cutting edge. And I hope if there's anything else we can share to help you do that, that's what we're here for. And again, Catherine from GHHI can speak to some of the ways they're pulling in housing, health dollars in particular to the space, which is really exciting and cutting edge work happening around the country.
Great. Any committee questions at the moment for Mr. Creswick? Okay. So let me ask, I had a couple of questions. In California, the $100, in order to gain the $100 a month savings, do you know what the average outlay was in terms of, what kind of energy investment did they make in that home in order to implement measures that yielded the $100 a month savings?
It's a great question. I'll send you the report as soon as we're done here. It just came out last week. But one of the things the California PUC did highlight was the capital investment needed, and that ensuring the right financial approaches was critical to overcome that initial capital investment to achieve those savings, particularly for low-income families. So that's where, folks can't afford right now to make big capital investments, let alone to even keep the lights on. and make some of these changes. And so ensuring that, particularly for affordable housing, low-income families, that these investments can happen at no cost to them is absolutely critical and vital.
I know that we've been looking into and will continue to look into some pretty innovative funding that helps try to solve that challenge by having the measures implemented by a utility that then does to the meter billing, and it doesn't become a loan to the homeowner or the rent, neither the homeowner nor the landlord nor the renter. And whoever's paying that bill is paying off the investment made in it. So it's a way to mobilize capital without taking debt on at the where it's delivered.
Yep.
So that we'll see more to learn.
And again, braiding together those different funding streams, right? Ensuring that housing, health, energy can all be brought together in one package is equally critical in that process.
Another question that's come up is we started talking about, instead of fuel switching, to talk about carbon impacts of different fuel choices, aiming for like a clean heat standard. Have you any experience with vetting renewable liquid fuels that are delivered? That was one of the things fuel dealers said to us. Don't forget that there's a chance to do biofuels that are genuinely sustainable. Well, so we need to vet them and learn more about it, but basically biofuels that are essentially renewable, and therefore, rather than always thinking about switching to electrification, which honestly I think is where we kind of entered the conversation. Beneficial electrification was the tune we were mostly singing, and they said, well, think about singing a second tune, and that is that you might modify some existing equipment and then burn renewable fuels in that equipment. So to the extent that can work, we're certainly interested in learning more. I don't know if you're seeing programs like that in the region and can comment on that one.
Absolutely. I'm actually a co-author on a report on fossil gas alternatives and can share that as well with the committee here. I think the thing about these fossil gas alternatives, and typically we're talking about renewable natural gas and hydrogen are the two that come up the most, they are limited in supply and extremely expensive in many cases. And the best use of those fuels is not in easy to electrify sectors, right? The economic value is not in sectors of the economy that are easy to electrify, because electricity is cheaper, cleaner, and more cost effective, healthier, safer than these other fossil gas alternatives. So when you think about the best use of these fuels, it's in things like aviation, maritime travel, heavy industry, where you need process heat, in some cases in the hundreds, if not thousands of degrees. So buildings are not the place to be using those limited, expensive alternatives, particularly ones that are truly sustainable, like green hydrogen produced from wind and solar. Additionally, there are real limits on the pipeline distribution system in particular for some of these fuels. For instance, you can only put so much hydrogen into the pipeline system. And I know there's a lot of delivered fuels in Vermont and in New England. And that's a little bit of a different situation, but the same is true for appliances. You can only use so much, you can't operate your current appliances on hydrogen fuel, for instance. What Massachusetts found, again, the Massachusetts administration found, was that relying on those fuels in the building sector would increase delivered fuel costs by 2 or 3 times. I mean, just simply uneconomic compared to the cost of cold climate heat pumps, induction stoves, and electric appliances. So we really need to be using those those fuels that are alternatives that are truly sustainable in other sectors rather than buildings. It just doesn't it's not cost effective or make economic sense to continue to do so. It just doesn't work, the math.
Okay, and the math that you're referring to, so there is a supply, but it's small at this point, and there's more demand for it than there is supply, so it's pricey, or is it the cost of production is significantly higher? Can you explain why it's pricier?
All of the above. So even the gas industry itself, which is promoting some of these alternatives as kind of the solution, found that supplies of renewable natural gas, for instance, would only it can only replace about 6 to max 13% of all gas supply in the country, right? So with hydrogen, if you think about the just physics of it, and leads to the economics, if you take clean electricity, wind and solar, turn it into hydrogen, transport that hydrogen, and then burn it, that is a far less efficient process than simply taking that same wind and solar and putting it straight into an extremely efficient, 300% efficient in some cases, cold climate heat pump. So there's no way for when the fundamental source of the original energy, the wind and the suns, wind and solar, is the source for that fuel. It is just far more efficient to use that directly in electric appliances than to turn into hydrogen, transport it, and then burn it. So again, the fundamental physics and economics of this don't work out for hydrogen or these fossil gas alternatives when it comes to a use in buildings and fully displacing the use of gas in the country. And that's where, again, it's far more efficient, cost effective to use those fuels in places where you can't just directly use wind and solar or like clean electricity, again, like aviation, maritime, heavy industry.
Right. Well, that makes sense. Senator McDonald, did you have a question?
Nope.
Okay.
I'm sort of comparing in my head the geography and type of grids, and we don't have natural gas except in one section of the state, so there were different challenges, but
Can you say a little more about hydrogen? This is a beginner question. I think I've read this, but maybe I'm making it up. Do they end up blending hydrogen with gas or is that not a thing?
That's what they're talking about, but you can only use a very small percentage of hydrogen in the pipes before it's extremely corrosive and dangerous, and you can't use significant quantities in appliances. And so that's, again, where hydrogen makes a lot more sense produced on site next to, for instance, an industrial process that needs a large amount of process heat. And again, when it comes to Vermont, again, as you noted, Senator McDonald, that relies on a lot more propane, fuel oil than gas for heating. Again, those fuels as well cost a lot more than either electricity or gas. So again, it's a lot more cost effective to use cold climate heat pumps than those propane, fuel oil delivered fuels as well.
I don't know if you've had an opportunity to investigate fuels derived from plants. Some people call it bioheat, so maybe soy as a source of oil that's then processed into a heating, quote unquote, green heating fuel. Have you had a chance to look into that?
Yeah, for sure. And I could share some of our testimony from Connecticut on this subject, particularly of a thermal renewable portfolio standard, where we've provided some testimony on that. Again, where the environmental impacts, the costs just don't pencil out relative to, again, cold climate heat pumps and some of these other technologies. They're not bad, but they're just not as cost competitive or sustainable. So happy to share that testimony as well.
Okay, great. Thanks very much. Any other questions from the committee? All right, thank you. Maybe we'll come back. With that, I'd like to move to Ms. Klinger. Good morning. Thank you for joining us.
Good morning, Senator Bray. Thank you so much. And I think my colleague Mark did such a fantastic job of really laying out sort of the landscape here in talking about these holistic interventions, that I will sort of quickly move into some just specific examples of the ways that my organization is identifying innovative and cross-sector sources of funding for these kinds of interventions, and then see if there's any questions around that. So I'll begin with just a brief introduction of sort of who we are and what it is that we do. So I'm Catherine Klinger. I'm the Vice President of Client Services at the Green and Healthy Homes Initiative. And our organization was founded in 1986 in Baltimore, but we've grown to become one of the nation's largest healthy homes nonprofits. And we're really focused on addressing social determinants of health and advancing racial and health equity through the creation of healthy, safe, and energy efficient homes. And when I say creation, it's not necessarily building new homes. It's really about addressing existing housing conditions in low to moderate income housing. So we work at the national, statewide, and local level to sort of advance upstream policies and best practices that improve housing conditions, as well as provide services directly to families. And the team of national professionals that I head up runs programs directly in Memphis, Tennessee, Jackson, Mississippi, and Rhode Island. And we also work with states like Connecticut, New York State, and New Jersey to put in place models for holistic housing interventions that address health, safety, and energy efficiency and connect with those states' broader climate goals. So again, just echoing what Mark said, I really want to congratulate Vermont and this committee for being so forward thinking in considering how this move toward cleaner energy measures really needs to take into account the needs of low to moderate income households and families and ensure that folks are not left behind as the state seeks to achieve the goals of greenhouse gas emission reduction. We know that retrofitting residential properties to a more renewable electric system of energy risks leaving low income households behind. And we know that in Vermont, as Mark said, there are some of the highest energy burden neighborhoods pay an average of 27% of their annual income on energy costs. And back in 2014, which this data, I'm sure there's updated data available, there was over 125,000 Vermonters who were fuel poor at that point. And that number has only grown, particularly in the light of COVID. I want to just take a moment too to talk about sort of the workforce development implications of this. So again, echoing what Mark said, we were part of a study with CEO, an organization in Buffalo, that showed that for housing professionals who were cross-trained to provide both energy efficiency and healthy housing interventions, which include energy audits and healthy homes assessments, there was an average increase of $2 to $4 per hour in salary, which translates into $4,000 to $8,000 per year, achieved just through cross-training those professionals to be able to provide holistic interventions. And I'll say more in just a second about what those interventions really look like. But we also know from our national work, again, as Mark laid out, that in low to moderate income housing, there are often health and safety issues which preclude households from being eligible to even participate in the weatherization assistance program or utility ratepayer funded energy efficiency programs. And those repairs can include, those required repairs can include remediation of lead-based paint, addressing sources of moisture infiltration and remediating existing mold hazards, remediation of asbestos-like material and vermiculite, which I know is a particular issue in the housing stock in your state, and addressing outdated electrical systems, knob and tube wiring, that sort of thing. So many of these same interventions are also directly related to environmental health conditions that contribute directly to poor health outcomes for families, things like lead poisoning, asthma, risk of injury in the household environment. And there's also some really good evidence that weatherization measures themselves can have an impact on improving health outcomes. So simply, for example, by reducing exposure to extreme temperatures, you can improve maternal and child health outcomes, reduce the long-term risk of cardiovascular disease. Those are all connected to the weatherization measures that are already taking place in housing through weatherization assistance programs and energy efficiency, utility ratepayer funded energy efficiency upgrade programs. So we know that a holistic approach can, one, address this sort of broad range of issues that folks are experiencing in their housing, and two, actually serve these populations who are often the same folks who are in and out of the emergency department because of asthma and facing high energy burdens, can sort of, that holistic approach can address all of those issues for that same population of folks. So having said that, I'll just mention too that, GHHI has sort of been on the forefront of this holistic approach. So back in 2010, our model for providing health, safety, and energy efficiency interventions in housing was sort of adopted by the Department of Housing and Urban Development as a national model for how they approach housing interventions and funding for hazard remediation in housing. And most recently, that same holistic model was the basis for what we think is a pretty innovative funding initiative coming out of HUD in the fall of 2020, which is a grant that provides administrative support for aligning and coordinating weatherization assistance program funds with lead remediation and healthy homes funds, so that Jurisdictions that receive both weatherization assistance program funding and lead funding can align those existing programs to more effectively and holistically address energy efficiency and health and safety hazards in housing. And so 5 of those grants have gone out in this most recent funding cycle, and we have learned that in the budget for the next fiscal year, HUD also has additional funding to be able to make some more of those grants nationally. So I'm just going to switch to sharing my screen. Oh, I think, Jude, that I might need to be able to share.
You have it now.
Great, thank you. Okay, can folks see that?
Yes, we can. Thank you.
Okay. And so, as I said, I'm going to sort of move quickly to some examples of how GHI has done this work across the country, but just to sort of take a look at what we are talking about when we talk about a holistic approach to housing, health, and safety. Obviously, asthma is disproportionately costly, and this is true in Vermont as well as nationally, in terms of immediate healthcare cost and cost burden, particularly for the Medicaid population. And it's directly attributable to conditions in the home. So we take a look at an evidence-based, and there's lots of evidence to support the fact that home repairs, when they're paired with some in-home asthma education, can substantively reduce asthma severity and the number of asthma episodes per year, and really have an impact on the total cost of care for patients experiencing asthma. Similarly,
sorry to interrupt. Do you happen to have Vermont specific data for asthma rates?
So I don't, but I can certainly pull that and take a look at the publicly available data for how much asthma is costing the state. And I can sort of take you through an example of how we did that for the state of Connecticut. Let me just jump forward just a little bit here for that. So one of the projects that I'm going to specifically talk about today is our work in the state of Connecticut. And this is some of the information that we utilized to do an analysis of the specific cost of asthma and household injury for the state of Connecticut. Again, something similar could be done for the state of Vermont to take a look at the exact burden for your Medicaid population specifically. But we know that statewide, in Connecticut, over 2,000 children under the age of 6 had elevated blood lead levels, and 21,000 asthma-related hospitalizations, costing well over $100 million in Medicaid claims, as well as falls, trips, and slips. Now, that type of injury is particularly costly and detrimental for older adults who are seeking to sort of age at home. And in the state of Connecticut, they're really interested in reducing the burden of reducing long-term care facility placement for older adults, and both the cost burden on the Medicaid system for that placement, but also the ability of older adults to age where they want to age, which is most often at home. And so what we did for this project is, working with a cross sector of state agencies, we took a look at a data set of 3 years of Medicaid data for the state of Connecticut, and looked at the total cost of care for specifically patients who had experienced asthma episodes or were at risk for a slip, trip, or fall in the home environment, and then compared what we know to be the evidence-based reduction in the total cost of care as a result of these kinds of housing, health, and safety interventions, compared that with the cost of actually providing the interventions, and projected that over a 5-year period, these interventions would begin to pay for themselves in roughly year 4. Again, with the Connecticut specific Medicaid population that we were looking at, and looking at that total cost of care. So not just reductions in claims related specifically to asthma or household injury, but reductions across the board in the cost of care for that population. So that analysis is something, oh, go ahead.
Yeah. I can't remember which one of the Carolinas it was. I've heard that maybe South Carolina, I don't know, North or South Carolina, talked with CMS and was allowed to basically pilot using Medicaid dollars to make fixes. I don't know exactly of precisely what was allowed. That was a little bit like, writing a prescription for the home, not just the occupants of the home. Like, Can you say a little bit about that?
Sure, and this, I think this slide sort of lays out a lot of the different options that GHHI has explored, along with other partners in this space around how healthcare can make an investment, similar to what you're saying, Senator, about the different options within the Medicaid system for how investment in housing can actually be made. So the first is hospital community benefits, and we have a great example of that in the state of Pennsylvania. There's one of the largest health systems in the state has stepped forward and is planning an investment in lead remediation in the housing within their footprint of service, and really utilizing hospital community benefits after linking that to their community needs assessment, determining that lead poisoning was one of the social determinants of health that they wanted to tackle with their community benefits dollars, and then going ahead and planning that investment over time. So that's one way that healthcare dollars can be invested in a really meaningful way in housing. Another is through the Children's Health Insurance Program state plan amendment sort of lever. And so oftentimes in states, and I believe Vermont is one of them, there are administrative dollars from the CHIP program that can actually be leveraged to make a direct investment in addressing social determinants through a state plan amendment. So if the state makes a determination that they would like to use leftover administrative dollars to tackle a certain health issue for a population that is served by the CHIP program. And oftentimes this sort of comes into play around lead hazards, but also in the state of Maryland, for example, they've dedicated $14 million in CHIP administrative dollars to remediate asthma hazards as well. Did I hear a question there?
No. I mean, you maybe if you can hear me thinking, I'm wondering how does Vermont get engaged in opening up this avenue to make a. We have actually, this committee has worked with the Department of Health now for 4 or 5 years, and they have produced documentation. They've looking at the health benefits related to weatherization. And I don't know how it's apportioned community health benefits through lower emissions versus health benefits that are received by the occupants of the home. But by year 10, they were estimating that the health benefits would actually, I think, surpass the benefits in terms of saved energy. Mm-hmm. So it was not just a small, nice kind of add-on. It was actually the same order of magnitude, and yet we don't really, for the most part, have programming that sees and captures that value.
Yeah, I think that's a really important point. And so, and oftentimes that value is across sectors, right? So it's felt in the healthcare sector, but it may also be felt in the education sector through reduced costs related to special education because you're preventing lead exposure for children, for example, right? So that's sort of why a lot of this focuses in on asthma as a key social determinant and health condition to tackle, because there is kind of an immediate short-term reduction in healthcare costs that you can point to and really monetize, quantify, and then reinvest back in housing interventions. So a lot of the work that's done here has really centered on asthma for that reason.
And I should correct myself because I just misstated. I said something awkwardly, and I'm not giving credit to the many actors out there in the ecosystem of delivering these services that are well aware of this. What I really work to provide more comprehensive service, like eliminating tripping hazards, improving indoor air quality, et cetera. I think what I really mean is that we haven't necessarily found healthcare dollars, which total in the state of Vermont, they're about the same number of dollars as we spend in the entire state budget. So it's when we're looking to fund things, when I see a genuine nexus and the amount of money we're spending in that area is significant, like same size as the state budget, basically. Mm-hmm. It makes me think that's a productive area to look for a genuine collaboration and maybe some funding that helps bring those healthcare dollars into this work directly.
Yeah,
but we don't know how to do that yet.
Yeah, and that's a place where, just based on the work that we're doing in other states, potentially we could be helpful there. I mean, the CHIP state plan amendment is a relatively low or light administrative lift. and really could be something that you could engage in, almost immediately with the cooperation of your Department of Health. It's really just about going to CMS and saying, we'd like to submit an amendment to our plan to tackle this, specific issue. And this is just an example of 2 states that have done it, but there are many more that I'd be happy to share with you, kind of the specifics of their state plan amendment. It's really a question of if those administrative dollars are already being used for something else. So for example,
Right.
we tried to do this in New Jersey and they used a lot of that, that resource toward tackling opioid addiction. So that was another, place where we tried but sort of failed to get it invested in housing.
Right. I'm sure those systems are under stress.
Yes.
And no one is looking around to saying, we have extra money in this shoebox. We would like to find a program that would like to use it. Right.
Although we did find that there was some administrative funding on the table that was being underutilized, at least prior to COVID. So the other place we've been able, and this is not strictly speaking healthcare related, but we've been able to leverage some of the CDBG CARES supplemental funding in states like Rhode Island and in Tennessee to actually do workforce development, specifically around cross-training in the energy efficiency and healthy home sectors. And so the idea there was, sort of a healthy homes response to COVID and building capacity in the workforce to address the economic kind of fallout of the pandemic. And so we have a program up and running in Central Falls, Rhode Island, that is training Spanish-speaking housing contractors to become cross-trained in energy efficiency and healthy homes. And then similar program in Memphis, Tennessee, that's really focused on low-income communities of color.
Right.
So just a thought there, sometimes there's these sort of pieces of funding that are available that can be pulled together in creative ways.
Sure. And I realized I asked a number of questions and made you jump ahead in your presentation. So I want to quiet back down and say, if you want to get back to some things that you wanted to share that you skipped past.
Yeah, that's quite all
do.
right. I'm happy to sort of jump around to talk through what's of most interest, but it might be helpful to really pull back just a little and talk about what a holistic housing intervention can actually look like. So this is, really about an intervention that identifies a population of folks that have a specific health issue related to their housing environment, and pairs home repair that's targeted specifically to health-related housing conditions with other evidence-based best practices like home visits, follow-up referrals, and coordination with medical providers and medical case management for these conditions. And so oftentimes it takes the sort of form of a number of home visits over time where an assessment is completed that comprehensively looks at the environmental health of the building and then the energy inefficiencies in the property, as well as coordinating a scope of work and providing repairs and follow-up. And then really evaluating the outcomes. So in addition to looking at the cost savings that's generated as a result of these interventions, looking at improvements in academic outcomes, overall quality of life, energy burden, and then community level outcomes such as economic mobility and workforce development capacity as well. So in just getting back to the Connecticut example for just a moment, what we identified was sort of this holistic vision, right, of a project where anyone across the state, whether they are coming into their health facility to seek treatment for asthma or another environmentally related health condition, or they're going to the utility for energy efficiency services, or they're seeking other kinds of housing repairs, can get access to a holistic intervention that addresses health, safety, and energy efficiency through this sort of evidence-based model of providing housing interventions. And so we're seeking to pilot this right now in Connecticut, and then eventually scale up to a statewide service delivery framework. But the idea is to unlock these healthcare dollars to be able to pay for more of these interventions and to layer the health and safety interventions on the existing pretty robust ratepayer utility funded energy efficiency program in that state that aligns with their weatherization assistance program, which serves a smaller number of Connecticut residents. And the evidence base is clear that healthcare savings can pay for some health and safety improvements. It's also clear that addressing those conditions that directly contribute to health conditions in housing are not going to solve for all of the problems. So for example, knob and tube wiring and vermiculite are not directly related to asthma necessarily. And so we need additional sort of gap funding in the service delivery model to be able to pay for some of those housing conditions. And we've taken a look at how that could work in Connecticut as well.
In that last slide, HES and HESIE was what, please?
That's the Housing Energy Solutions and Housing Energy Solutions Income Eligible programs, which are their utility ratepayer funded energy efficiency programs.
Okay, thank you.
Sure. And so there's three phases that we're sort of engaged in right now. We're in the process of standing up the multi-site pilot and implementation, which has been a little bit slowed down by COVID, unfortunately. But the evaluation of the efficacy of this pilot will really center around a comprehensive analysis of the health-related as well as economic, technical, and operational feasibility of, can we do this statewide, and how might that look, and who do the partners need to be that are providing services to Connecticut residents. So I'll just go through one more example briefly, because I'm sure we're short on time at this point. But we're also working with the New York State Energy Research and Development Authority and the Department of Health to look at a statewide holistic pilot for housing interventions in New York State that really utilizes and leverages value-based payments. So in New York State, they have a mandate that managed care organizations are required to enter into contracts with community-based organizations that are addressing social determinants of health, providing services that address social determinants. And the mandate is pretty broad, so MCOs can choose which social determinant of health they would like to really focus on and which kinds of community providers they want to contract with. But in the context of this pilot, we are utilizing utility ratepayer funded energy efficiency dollars to stand up a pilot in year one, with the requirement that participating managed care organizations enter into contracts with these providers starting in year two. To provide holistic health and safety interventions that really focus on asthma for this pilot, and that are coordinated with the state's Empower Energy Efficiency Upgrade Program. And so we're currently sort of, again, a little bit delayed as a result of COVID, but really in phase two. Really in phase one of the process now, where we are seeding the market with $10 million in ratepayer funded funds to begin to provide evidence-based in-home education, healthy homes repairs. And then phase two will be the Medicaid co-investment in that pilot. In the context of that, again, doing a lot of workforce development and cross-training of implementers and providers, utilizing state funds through NYSERDA to do most of that work. So I'll just pause there. Those are the two examples I wanted to share today, and happy to talk through any questions that folks might have.
Great. I had one request for information you had mentioned, and I don't know if you could send it after, about energy burden or poverty in Vermont, how that plays out. The data you were citing, just helpful to us to have.
Sure, Senator Bright. And that data, that's a little old. It was like 2016. So I'm not sure if there is more specific statewide data that's newer, but I will take a look at that and see what I can find you that's the newest available.
Okay. And one of the things I think that we've learned about in the last month in this committee has been about the challenges to helping these programs actually get used. You could design a great program, but you need people to sign up and take action. And the root of that, it seemed, especially for lower income folks, was to have a trusted person who's meeting with them in a manner that's dignified, respectful, ultimately becomes sort of empowering to them, and as opposed to you're here in someone's, I'll just say it in a crude way that's kind of that offends people, that you're there to just get something, like that. It's very different than helping people figure something out and take steps where they're part of solving their own challenge, you know. So who are you finding delivers these? Well, one is I'm wondering what your experience is around that crucial sort of kitchen table connection, and who you're seeing do that particularly well.
Yeah, thank you for saying that. I couldn't agree more. And I spoke at a really high level about sort of what these programs look like. But as I said, we also provide a lot of direct services to families and communities across the country. And so I think what we found from that work are a couple of things. One are that community health workers are a tremendous asset in these types of interventions, and really in improving health outcomes across a number of different health conditions. But particularly in situations where you need to build a rapport and a trust with residents in order to be able to engage in what is a fairly invasive process, right, of doing a home inspection, energy audit, and then repairs to the home environment. Community health workers can be a tremendous asset in developing that rapport and are also able to deliver evidence-based health education that has been shown, at least in the asthma world, to make a real impact on health outcomes. The other thing that we do oftentimes is partner with trusted medical sort of anchor institutions in the community. So for example, in Memphis, we are embedded within Methodist Levant Children's Hospital and receive most of our referrals from either their home visiting programs or the asthma clinic. So that can be another, you know, tremendous asset in bringing people sort of into the program.
Great. I know that we've had a couple hospitals that have actually ended up, I had people with, I don't know if it was asthma, but some sort of pulmonary I think it was some sort of pulmonary issue that came to the hospital, spent time in the hospital, got better, went home, relapsed. And after a couple rounds of this, they said, let's look at the home. That seems to be part of the reason for these return visits to the hospital. And they actually, you know, quote unquote, prescribed sort of a home health energy update and determined that it, even though it has a fairly significant price tag, I think their work's averaging around $10,000 a unit, that medical costs can accumulate so fast that $10,000 is more affordable than you might guess when you first hear the figure. You know, the savings from not being in a hospital accumulate in a hurry.
Yes, that's absolutely right. One saved emergency department visit or one saved admission, particularly on the pediatric side, can be enough to pay for the cost of an intervention that mitigates asthma hazards in the home environment. So we found just nationally that our average cost for asthma-related interventions is somewhere between $3,000 and $4,000 per home. Now that's just asthma. If we're talking about a holistic approach, you know, obviously the price tag goes up when you start to address energy inefficiencies and injury hazards and lead hazards. But there's a relatively, you know, it's certainly the benefit cost ratio is there to do these interventions and save the cost.
Yeah. And can you say a little bit about your choice of asthma as the, you know, sort of is that a particularly, is there something about asthma that makes it a particularly good case for all the other health impacts that are also affected by home health?
Yeah, it's really about that immediate and quantifiable cost savings that's possible when you mitigate asthma episodes. And it depends on the population you're looking at. The cost savings are steeper, for example, for young children who oftentimes are likelier to be admitted. But, you know, in terms of, for example, lead poisoning by way of comparison, that preventing lead exposure in the home environment has a lifelong impact for that child, which results in better academic performance, reduced special education costs, more economic mobility and higher earnings across the life course, less risk for neurodegenerative disease and cardiovascular disease down the line. But oftentimes those benefits take decades to accrue and accrue to a number of sectors. So it's, while those have been well quantified in the literature, it's a little harder to make sort of the benefit cost, the economic case for lead poisoning remediation, for healthcare investment in lead poisoning remediation. Although some places are doing it, that hospital system that I mentioned in Pennsylvania has stepped forward to make that investment.
Yeah. Environmental health and public health seem to be, almost everyone goes, oh, this is a good idea. But maybe we're not quite ready to spend on it or change the behavior that is, the underlying challenge. It's both it's a
Yeah.
two-edged sword, right? There's a huge upside, and it's a little hard because you get into human behavior.
That's absolutely right. There is a behavioral component. I would agree. And I think what we view this as is part of the toolbox for investment, right? Healthcare is never going to be the full solution to the housing issue, but if you can add that investment into the, the sort of leveraged list of sources of sustainable funding, then you can make an impact.
Sure. Senator McCormick, you spent time in the healthcare committee. I don't know if you have anything you wanted to chip in.
Well, I just want to say that I do appreciate your identifying the nexus, because we tend to think of things as one thing at a time. In fact, those of us of a certain age were taught not to do things together, not to, what's the word for doing things at the same time? The term for multitasking. We're actually actively taught not to multitask. Stop it. Do one thing at a time. Finish what you're doing, then do something else. But the fact is, these things do overlap, and they do seem to stem sometimes from a common reason. There's poverty. It's a lot of it just has to do with not having a lot of money, and so it also makes sense that the person who's going in to insulate is going to notice, or should notice. They're in a position to notice that the air is too damp as well, that it all mixes. So yeah, I think this is of course, my only fear is that when you try to do too much at once, you do it all badly. But I do think we do need to be aware that these issues don't just overlap, they interlock. Thank you, Mr. Chairman.
Yeah, thank you. Any other committee comments or questions? And we have your, I'm on the screen here, so I'm not looking in the document folder. We have your PowerPoint, is that correct?
I'll make sure that you do.
Okay, so I can spend some time looking through it. I know there's a lot of material in there. Well, great. Well, thanks so much for coming in and sort of giving us a wider wilder and wider field of view for what's going on out there. So as we continue to work on a more comprehensive approach for our own programs here in Vermont. So thank you again, and you're welcome to stick around, but I figure I just don't want you feeling rude if you slip away now. I figure you all have things to do, and we're going to move on to the next item on our agenda, which is talking about budget related to this work. So thank you. So committee, I'd wanted to just pause because Senator Kitchell had asked committees of jurisdiction to, if there was something for the quote unquote fast track bill, please identify by Tuesday, the 23rd, that's today. I did reach out over the weekend to people who are doing weatherization work, and I said, does it, for instance, some of the community action agencies, as well as Ms. Phillips at the state OEO office, I said, does it make a difference to you if you receive your funds in like an April, May timeframe versus June, July, August? And they said, no, if we know money is coming, that's the most important thing. They have, they can manage their budget, but it's helpful to know what's coming. It doesn't have to arrive, doesn't have to be on their doorstep to spend immediately. So the only area that I'm aware of that at the moment where there could be some advantage is if we're trying to jumpstart in any way the workforce development piece that will begin preparing people for the growth of the work that we're taking on. For instance, the governor's recommend includes a 20% increase to $2 million to the home weatherization assistance project program. So I think they have enough slack in their system. My impression is that they can get started on that, but by year 2, they may need more people. I'm not hearing about urgencies. I don't know if there's any urgency to the proposal around VHFA yet. Like if they're going to, one, I don't think this committee hasn't signed off on that expenditure, but even if we are, we still would like to know when they need funds in order to do what and how much. So Senator Westman was asking about the different range of leverage that we've heard about. How many dollars become how many dollars once bonded, and we've heard different numbers. So we're having Ms. Maura Collins from VHFA in later this week, and we can check in there. Meanwhile, I'll ask her about is there any reason to be fast tracking money from her perspective? I don't know if any of you have given it some thought and have recommendations. Okay.
So can I just ask, the HFA's got $2.5 million in for workforce training. How does that relate to the home weatherization assistance program money?
Yeah, I don't think we have a clear picture on that one, and I think some of it depends on which part of the market they're addressing. I also asked Sarah Phillips to look into, so statutorily, they address the 80% of AMI and under population, but I've heard anecdotally that by the time you go through the sort of underwriting, for instance, do you have someone at home with a disability, or do you have children in that home, things like that, that by the time they do their projects, and this is something we have to hear back, that generally they're getting up closer only to the 60% AMI. Well, if that's true, then 60 to 80 is in essence not really covered by anyone, because if the next program kicks in at 80, who's filling that gap? And
I really only asked the question because I think the workforce development pieces we're not gonna solve workforce development by July 1st. And let's do it, make sure they coordinate and they're doing it right. So I wouldn't put the workforce development pieces out in front of anything else.
Okay. Yeah, and in workforce, some of the testimony we've had makes me ask the question, should we have a more robust and steadier training program available for people interested? So tomorrow is Workforce Wednesday. We're going to hear from a lot of people who do training and workforce development pieces, and be interested to learn who has this the need for workers in this industry in front of mind, and what they're doing to help us get there, and how we can help them get there. Okay. All right, so as always, if you have questions you'd like answered or witnesses you'd like called, please let me know. I want to make sure that we're gathering the testimony that everyone feels they need in order to finish putting together a proposal. Good news there. We should have a draft for the committee, I think, as soon as tomorrow. Today we're going to talk about this briefly at caucus. You know what the bill aims to do, and I'm going to invite, as other people are often interested in whatever the weatherization and energy bill of the year is coming out of this committee. Let others who want to sign on, but then time to have the bill in the room, and we'll have Ms. Chakowski in the room to help us work on it. It feels like there's pieces are coming together. Does anyone else have any new business questions, etc.? If not, we are finished for the morning. Okay, so thank you, everyone.